as you hold your cabinet retreat in Naivasha. One, we have a big crisis with all our hospitals. Kenyatta National Hospital is owed 1.6 billion by NHIF. All the Nairobi County facilities are owed 480 million by NHIF. Following up with the NHIF CEO, he says that his hands are tied. He is owed over 32 billion by the government for civil servants contributions. The money that he gets from members and private entities is not sufficient to clear all the outstanding amounts that are owed. Now, I'm just focused on Nairobi right now, but I'm sure the situation is a lot worse when you go countrywide. So while you're having this retreat and you've got the Treasury CS there and you've got the Health CS there, I think you've got the governor there. We need to make sure that NHIF is funded. The money that is owed for civil servants is paid, even if it's in trenches. If you release, we're releasing money every single day for various debts, CDF, GAF, Eurobond. We need to ensure that if we want to achieve universal health care, that we release money to NHIF. So NHIF in total owes Kenyatta National Hospital and Nairobi County facilities 480 million. So we're talking 2.1 billion. With 2.1 billion, basically Kenyatta National Hospital gets to breathe, and all the county facilities also get to breathe. The county facilities are having a huge problem. They are holding some patients, and they try as much as possible to wait until the patients can raise some money. I'm at Mbagathi Hospital today, and I've tried to raise about 350,000 so that I could pay 50% of the bill to release 60 patients who are crying and in dire need to go home. All right, so 50% and the patients will go home. So I'm just thinking if we could get a figure, because it's terrible to ask the hospitals to keep waiving these bills, and then we're not giving them the NHIF, we're not subsidizing them for the waivers, and they're struggling. As we transition from NHIF to SHIF, we need to figure out a way to cushion the very, very poor that are in these public institutions, these public hospitals. Like here in Mbagathi today, hopefully we will release 60 patients, and those 60 patients, if with years, they have waived over 8 billion shillings in waivers, and most of the patients that have gone off, even if they make pledges of paying 1,000 or 2,000, they're not able to do it. So for me, it's to really appeal to you while you're in Naivasha, before the CS of Treasury leaves and the CS of Health leaves, can we have a commitment to release at least 5 to 10 billion to NHIF so Nairobi can get its 2.1 billion for Kenyatta National Hospital and the facilities that are in Nairobi County. And then also we would need some kind of push to look at the total waivers that we have from the hospitals over the years, and how can we cushion them, because the hospitals are actually going to be paralyzed, and if they're paralyzed, we will not be able to achieve universal health care, which I know is dear to you. So please, I'm appealing, can Treasury find some money to pay on to NHIF? I know we want to transition to SHIF, but NHIF needs to meet its obligations, and this money has to be paid so that they can pay the facilities that are offering services, because that is a big struggle. On the side of education, I also know that you probably have the CS of education there, and education, we have a big problem. So many parents have not been able to pay fees, and the schools are owed millions, and these schools are actually struggling. So while we're trying to figure out, we've already told the schools, do not detain or hold any certificates, let the children get their certificates after they've finished Form 4. Parents are not able to meet the obligation to the schools, and again the schools are collapsing. So whatever we do, we always are bailing off institutions like Kenya Airways, we're bailing off Mumias, we've bailed off Uchumi over the years. We need to bail our hospitals, we need to bail our schools. The public schools in Nairobi are owed between 15 and 25 million, for unpaid fees. They keep sending the children home. The children stay home for a term, 2 months. They miss school. They can't catch up. So we are actually collapsing the whole education institution. So for me, is can we also find some money and look into how much are the schools owed by parents, and can we write it off? We write off a lot of debt, and most of this is corruption related debt. Can we write off hardship debt? This is hardship. These families are going through a lot of hardship. Enjoy your retreat, but please, let's have some solutions for universal healthcare and for education.